Hi everybody, so I guess since my video suddenly blew up, I decided I'm going to make some web series related to Cystinuria for people to kind of hear my story of the side of things. So I think a good first video to go over for every Cystiniuric or stoner, as I found out we're being called now, is about medication. I'm just gonna show you guys what a daily Cystiniuric's medication looks like, which is not fun, to say the least, especially when you're carrying many pills around, to say the least. So we'll kind of go over some of the ones that are really essential to the Cystinuuric's kidney. So this one right here is called potassium citrate, or Uracit K. This one that I take is a 1080 milligram or 10 milliequivalent tablets. They look like this bad boy right here. So per dosage, I take 2 of these 3 times daily for Uracit K, or potassium citrate. The other one that is very commonly used, especially stateside, and it's starting to go more European, is Thiola, or as the Europeans may know it as tiopropen. This one right here is actually made specifically for Cystinuurics. This one's really cute. It actually looks like a little M&M. It even has a little M on it. Not that I'd call Cystinuria a cute disease. But these ones I actually take 9 of these a day. So I take 3 tablets 3 times daily. I really wouldn't call them tablets. I guess they're little M&M pills. But kind of to go over this one, because this one's really interesting, and I'll go touch back again on potassium citrate. But tiopropen, or Thiola, what this does, it actually binds cysteine, the amino acid that causes the condition cystinuria that doesn't process when you're a cystiniuric. It actually causes the cysteine to get bound with the medication inside your kidney and your bladder, everywhere else that you'll see a bunch of stones because of cystinuria. It actually binds with that, so that way the cysteine does its best to actually pass through your system. Now, a lot of doctors will only prescribe you maybe 3 pills a day, once a day, twice a day, tops. My doctor kind of took the daring escape, since she didn't really know the upper bound. There really isn't an upper bound known for Thiola. She prescribed me 9 a day, and it's worked for me ever since. I mean, I've been stone free for 2 years, aside from small instances, but they've literally been itty bitty tiny kidney stones that I've never even passed. Most of them either just distill away or something. To go back to the potassium citrate, what this does for a lot of people with different kidney diseases and stuff, it actually alkalizes your urine to where it's harder for stones to form. The higher the alkalization in your urine, the harder it is for the stone to actually form a concrete stone that can be passed or get stuck in your ureter, cause kidney blockage, which most of us know is not a lot of fun. So this one's kind of a really important thing too, even with the special stones of cystinuria. Cystine stones are really different, and there's debate on whether or not alkalization of your urine really helps with cystine stones, but I'm a strong believer that this is a big lifesaver too. And it's really good for you. Potassium, citrus, really can't complain. Another interesting thing about Thiola is that it actually has quite a few amount of side effects, way better than the one that they used to use though. But I know one that I had trouble with Thiola is that it actually kills your immune system. So trying to get on something that will improve your immune system, such as citrus, really helps when you're taking Thiola. Don't be afraid if when you start taking this you see a rash. It usually goes away. If it continues after about 6 months, you literally have to give it a lot of time. If it continues after about 6 months, you should really talk to your doctor about maybe getting switched to something else, or lowering your dosage, maybe even a higher dosage, because you could just be needing more for your body to actually use the essentials that are contained inside tiopropen. So don't forget about the rash. Some of the other side effects that I've heard from people is their mouth hurts, their tongue swells, their throat gets scratchy. I think a lot of those are tied to the immunodeficiency caused by thiopropin. So maybe talk to your doctor a little bit more about the side effects, even if they don't know a lot about the disease. Sometimes talking about the side effects will really help you. The last medication that I take is captopril, which was originally one of the first medications that they found that worked for cystinuria. It's actually a high blood pressure medication. I do have hypertension also, so it kind of was a cool trade out that there's a medication that will both help my cystinuria and will help my hypertension. But this little guy really isn't that intrusive. I take one of these in the morning and one of them at night. And it's just a little guy right there. So when you're training on these to first get on them, they usually have you take half a tablet or even a quarter of a tablet for those of you that have children that have cystinuria. They may even prescribe them half a tablet for the duration of their medication until they get to be, say, 14, 15, 16. But in a combination between all of these, I mean, just to kind of show you what my morning dosage would look like for those of you that aren't cystinuria sufferers. A handful looks like, let's see if I can get my camera to cooperate here, looks like that. And I don't know about you, but that much medication isn't fun to cart around. My biggest helpful idea, I guess, for people trying to manage their medications, get pill boxes. I have 3 of them, one for the morning, one for the afternoon, and one for the night, for each day of the week. So that way I can organize out my pills so I know when it's time to order my pills. I know if I forgot to take a medication, which is a really bad thing with cystinuria, because if you don't take your medication, problems can occur overnight. In case you didn't know that, problems can and usually will occur overnight if you don't take your medications, especially if you miss more than 2 doses of your medication during the day. Also a pill box, the tiny ones that are about this big, to cart around with you just in case you go out somewhere. It's always a great idea to have one of those because then you know that your medication is with you. Setting alarms on your phone, great way to remind yourself that it's time to take some medication, especially if you have a normal 9-to-5 job. It's a little harder for me to do that being out and about all the time. But just some ideas that, you know, I'd really like to share. Now, I know someone had asked on the International Cystinuria Foundation page if I had ever experienced being turned away for pain medications. No is my answer. I guess I'm just lucky enough to have such a great medical system in San Antonio that cystinuria is a little bit more well known than other parts of the world or even other parts of Texas and the nation and the United States. Let alone from the horror stories that I've heard from overseas in Europe and Australia. But it is something that I've heard is a big issue with a lot of people being turned away as seeking pain medication so that way you can get high off of it or whatever. I just think the easiest thing to do with that is I know one person had talked about how they had to bring in a note from their doctor explaining the situation, explaining the disease, and now they have no problem getting carted right away to the emergency ward, getting the medication that they need to deal with the pain. I can tell you from experience, the one medication that really worked for me was hydrocodone. I am allergic to it though, so I can't take it anymore. But hydrocodone is a great medication for dealing with pain. It does make you feel a little bit loopy. And whenever I used to take it, it really helped calm me down. It really helped settle the pain that was in my flank. But allergic to that one, so I can't take it anymore. So this video is getting up there in time, so I'm going to cut this one loose. Look out for another video next week. I may be talking about the other biggest question that people usually ask me, or that is commonly asked on the International Cystinuria Foundation page, is what kind of diet can I do? So I'll be going over kind of what I eat, how much water I drink, which is a crazy amount when we start talking about that. So thanks a lot for the support, by the way. If you know someone with cystinuria that doesn't know about my videos, please send them my way, just so that way they can see, you know, someone out there that's your everyday person, you know, let alone a college kid suffering through something like this that, you know, people normally think about kidney disease and they think, oh, well, you know, they're just older and that's what it comes with. But it's not the case. A lot of us have been suffering for many, many years. Even some of our older people within our community, they've been suffering for a long time and didn't even know about it until recently. So anyone that needs help, please just send them my way. Send them to the International Cystinuria Foundation Facebook page, or you can send me a message if you need any more information. Thanks, guys. See you next week.